Hi, my name is Jill Gilbert, and I'm an Associate Professor of Medicine here at Vanderbilt. I am a member of the Vanderbilt Ingram Cancer Center, and I specialize in the treatment of head and neck cancer. I'm a medical oncologist and deal with chemotherapy and its side effects. Today I'm going to be talking to you about pain associated with cancer and its treatment. Why do we get pain? Well, pain is our body's way of telling us that something is wrong, whether it is a fractured ankle or cancer, for example, touching something that it shouldn't be touching and irritating that part of your body. Pain is actually your body's natural way of telling you there is danger and to do something about it. So it is important for you as a patient to tell us when you're having pain so that we may take care of it and also evaluate the underlying cause of the pain. While pain is a common problem in cancer and its treatment, it's still not acceptable, and it's very important for you to notify your provider if you're having pain. What kind of things do you need to tell your provider? Well, you need to tell your provider what the pain is like. Is it a throbbing pain? Is it a burning pain? Is it a stabbing type of pain? Where is the pain? Does anything make the pain worse? Does anything make the pain better? And very importantly, we want you to quantify the pain on a scale, with 10 being the worst kind of pain and 0 being no pain at all. Again, these are very important measures for your provider to understand how best to treat this. Based on the kind of pain that you have, your provider will give you specific medications. Some of these may actually be over the counter, but some of them may be stronger medicines used for something called neuropathic or nerve pain, or even narcotic pain medicines that require a very specific prescription. Let's talk a little bit more about narcotic pain medications. You may have heard a lot of different things about this type of medication, but they can be extremely useful when used in a safe environment for cancer pain. But your participation and your communication when using this pain medication is going to be very important. Here are the things you need to think about. First of all, you need to make sure you understand what kind of narcotic pain medicine you're taking. What is the dose and how often are you supposed to take it? Then you need to keep a log of how often you actually do take the pain medication. Moreover, you need to keep a log of where the pain goes on a 0 to 10 scale, with 10 being the worst, when you do take the pain medication. For example, if your pain starts at a 7, does it get to a 3 or does it get to a 0, meaning absolutely no pain after you take the pain medicine? Also, you want to record how long the pain relief lasts when you do take the pain medication. This will help your provider figure out if you need 2 types of pain medications, one that is short-acting to provide breakthrough pain, and one that is long-acting to give you a strong and steady amount of pain medicine in your body continuously to prevent the highs and lows of pain that you might be experiencing. But again, your participation in this process is critical. Another thing that I want to mention is that this is a narcotic pain medicine, and it is something requiring a very specific prescription. It is up to you to keep track of your pain medicines, lock them up, and make sure they're not available to anybody who might want to take them, including children or animals. What are the possible side effects of pain medications? Some people do experience these, and it's very important for you to have this discussion with your provider. Some side effects we can prevent, but others we can't prevent, but we need to know about them to best manage them. One of the more common side effects is drowsiness or sedation. This can be very troublesome to the patient. We tell patients not to operate heavy machinery or drive, especially when we're starting them out on pain medications or adjusting their dose. Most patients become tolerant to the sedative side effects of narcotic pain medicines, but again, this needs to be monitored over time to decide if the particular medicine you are on is the right one for you. Some people can have nausea or vomiting on pain medications. Again, it is very important that you discuss this with your provider. Sometimes we will give you anti-vomit medicines, or sometimes we will actually need to change the particular type of narcotic that you are on to make this side effect less prominent. Constipation is a very common side effect on pain medications. Your doctor will give you a bowel regimen to help prevent constipation, but it is very important that you notify your provider if constipation occurs despite a bowel regimen.